Some people and they say HIV na fake, like na sick way with mind and just carry it some more for scared people. What you ever say to them people and they?
I dey tell me people out there say HIV na thing where they exist. HIV not so fake. HIV na real.
Tell Fambulem what you know about HIV. Maybe na your idea about HIV.
HIV na real sick. A disease so they kill. A reality. Not so fake. So let me aware of that. But I don't see nobody who asking to me. I said this person HIV. I'm not saying it. Like how Ebola can know and sick. Until man is here.
HIV is a global emergency that affects all regions, with most cases in Africa. It remains one of the most significant public health challenges. It causes millions of deaths and suffering, with impact greatest where there is poverty. It has no age limit and is increasingly an important cause of morbidity and mortality in many African countries, including Sierra Leone.
HIV continues to be a major global public health disease which has claimed more than 35 million lives so far. In 2017, WHO estimated that there was about 940,000 HIV-related deaths globally. At the end of 2017, it was estimated that there was about 36.9 million people living with the disease. 93% were adults and 7% were children. And of this population, 30% do not know they have the disease, and only 20.9 million are receiving ART.
The prevalence of HIV in Sierra Leone is 1.5%. The key population affected are the commercial sex workers. As of 2017, 67,000 Sierra Leoneans were living with this disease. Among these, 5,000 are children below the age of 15 years.
We and somebody within the same host. Last time you say me within the same host. The one per we HIV. The person who the next person get some because na the same host.
Yes, because now they use the same item them. Now they use the same cup, same spoons, but you come back, you can use them back. So you can see back and sell back to you back.
But HIV, I think I say that them my business and it cause a problem. Because so many care about himself and he maintain himself. Somebody do that, in business passes to 5 man.
Individuals can reduce the risks of acquiring HIV infection by limiting the exposure to its risk factors. There are key approaches that one can use that will help prevent the infection, which are safe sex, HIV screening and counseling, safe blood transfusion, use of antiretroviral drugs, prevention of mother-to-child transmission, and last but not the least, a proper disposal of materials that have already acquired the virus.
HIV is spread by the use of contaminated needles, syringes and other sharp objects, medical operations where the instruments used for cutting or piercing were not sterilized, or experiencing accidental injuries from piercing objects, which is common among health workers.
Having unprotected anal or vaginal sex.
HIV can be transmitted by the exchange of a variety of body fluids from infected individuals, such as blood, breast milk, sperm, and even vaginal secretion. Individuals cannot become infected through ordinary body contact, such as kissing, hugging, shaking of hands, sharing of personal objects, and even sharing of food and water.
Let's imagine that our body is the country, the HIV, the rebel, the CD4 cells are the soldiers, the opportunistic infections, the bad people. When the rebel enters our body, it multiplies and kills the soldiers. Then there will be decrease in the number of soldiers to fight against the bad people and the rebel, because the rebel has already weakened our body defense system. This can cause opportunistic infections to set in. The advanced form of the HIV infection can lead to AIDS, which can take 2 to 13 years to develop.
There are 3 stages in HIV infection. The first stage is called the primary infection.
After the initial infection, individuals experience fever, headache, rash, or sore throat.
This usually occurs 2 to 6 weeks after exposure to the virus. The second stage is called the asymptomatic or stage of clinical latency. This follows immediately after the primary infection and is variable. It lasts between 7 to 10 years. So the infected individual at this stage show no sign of symptoms of being sick. But however, replication of the virus continues within lymphoid tissue, and it's also at this stage that they become contagious and can transmit the infection. The third and final stage is called the symptomatic HIV infection, or AIDS-defining stage. So as the infection progresses, the CD4 count falls and the viral load rises. The patient presents with an array of signs and symptoms
like swollen lymph nodes, diarrhea, weight loss. Without treatment, the individual may also develop other illnesses like tuberculosis, meningitis, bacterial infection, and cancers.
Before the test, we tell individual what HIV is.
The process of HIV testing is voluntary, and everyone has the right to reject it. Request for mandatory testing by family member, a healthcare provider, or any other authority is unethical, as it undermines good public health practice and violates the rights of an individual. Prior to testing, the consent of an individual is sought, and the process won't be done without his or her approval. Results from the process is not made available to the public, and the wish of the individual in relation to disclosure of his or her results is respected.
HIV testing in Sierra Leone has advanced, and now quality assured results are being provided. There is a national testing using serialized testing algorithm, for which type 1 that tests the screening test, and then type 2 that confirm if it's positive or negative, for which the result is given out. All positive results, according to quality assurance protocol, are to be also taken to the Central Public Health Lab for further testing, i.e. using enzyme-linked immunosorbent assay, ELISA, to confirm using the national ELISA algorithm. And the viral load now is available for positive mother or positive individual to ensure the level of viruses is monitored as per treatment is being implemented. It also informed the effectiveness of the ART protocol. So in short, testing capability in Sierra Leone is advanced, it's ongoing, and it's improving on a daily basis.
Surgeons normally don't manage HIV patients for the disease itself, for the HIV itself. We can manage you because you have got a complication of the HIV. We can manage you because you have a disease which is different from the HIV, yet you have the HIV. So the management will depend on what brings you to the hospital. There are specific precautions we take when we are managing HIV patients. We know, for instance, that if you are HIV positive, you might not be able to fight the complications of surgery easily. To enable you to do that, we support you. The most important supportive mechanism we have is to protect you from developing an infection by giving you antibiotics. Nowadays, things have changed, but in the olden days, penicillin used to be the drug of choice. Nowadays, it is not. There are other much more active components that we give patients if they have HIV to avert, to prevent them from developing infections, because infections might kill them.
HIV-infected pregnant women can reduce the risk of transmission of the virus to their babies by using effective antiretroviral therapy during pregnancy, and by going to health centers so that professional birth attendants can reduce the risk of traumatic birth injury during delivery, and if possible, perform cesarean section.
When a baby is born to a HIV positive woman, there is still an increased risk that the virus could be transmitted to the baby, most especially through breastfeeding. This could, however, be avoided using two main methods. One, the baby could be breastfed for 6 months exclusively, but however, the baby will be treated with antiretroviral drugs to prevent transmission of the virus. And two, the baby will not be breastfed, but will be fed with formula milk. During the implementation of either of these methods, one, the baby would be tested for the presence of the virus so that adequate treatment plans would be undertaken, and two, the mother must continue taking her anti-HIV medicines.
HIV/AIDS is a reality. It is still a burden in Sierra Leone. Children are affected, and when they are infected, it's an important cause of morbidity and mortality in them. The most important cause of transmission in children is from mother to child. So for us to prevent HIV/AIDS in children, we need to test women of childbearing age. If they test negative, they have to practice safe sex to reduce transmission and prevent unwanted pregnancies. If they test positive, they need to be enrolled in HIV/AIDS program so they can be followed up to improve care. Children born to mothers with HIV/AIDS should also be enrolled in the program to improve treatment and outcomes. When they get older, they should be informed about the disease to increase their participation, cooperation, reduce stigma, and improve outcomes in them.
Effective antiretroviral therapy has transformed the management of HIV infection with a movement away from just treating opportunistic infections in immunocompromised patients towards delivering long-term suppressive effective therapy with access and adherence to potent and tolerable antiretroviral drugs in a well-managed clinical setting. Now, even though there is still no cure for HIV, but the aims of management of HIV are to improve physical and mental health, to improve the standard of living, to increase survival rates, to improve and maintain immune function, to prevent the onward transmission of the virus, and to provide necessary support where available. Now, this can be achieved by providing maximal and long-term suppression of HIV infection with the use of very potent antiretroviral drugs, and it involves a multidisciplinary approach.
The Society for Women and AIDS in Africa, Sierra Leone chapter, is a women-focused organization actually mitigating the impact of HIV on women. Our target groups over the past years have been women living with HIV. We provide a comprehensive package for them, which includes psychosocial support, nutritional support, a safe space for them to come and share experience, to come and provide peer support to each other. We provide sensitization to female sex workers. We provide them with a HIV prevention package in the form of condoms, lubricants, and also information, education, communication materials. And those who are found HIV positive, so we make sure they're put on treatment and then we follow up on them. Now, being very gender sensitive, we're not only dealing with women, we're also dealing with men living with HIV. I think it's all about building their self-esteem, making them think that living with HIV is just like living with any other disease. So at SWASU, we're all sorts of counselors. We're marriage counselors, we're psychosocial, we do all sorts of counseling for our women. It's one big family, and the message of hope is always there, such that you walk into SWASU, you can't tell who is HIV positive and who is not. And people are always curious, and I say, you don't need to know. We're all workers, we're all SWASU.
Yeah, 2000, now I can sick. But instead I be the rally first, then I be Osula. SWASU, then go pick me down there, then we go and find people who are sick. Then go down there, then go meet me as sick. So then came me to hospital, go test me, and say I get HIV positive. I start for doing emergency. They begin to talk to me, say if I do my daddy business, if I rally, I go to use condom. And mommy make back, I go learn something. Not only no more, make I go learn something. Say for that we will be self-reliant for myself. I go learn something. And I born me picking there. I get 4 picking. I get 2 girls, 2 boys. Go they all chubby. He say let be somebody. Not also somebody we know I been the guy. I not be able for sit down me do me company. But now able for sit down any kind side able for did. So HIV here. So if you go test anybody for HIV, say HIV no real, the person lie, pass he die. But HIV real. If you go test, you agree for taking antiretroviral drugs, then they go able to sustain. I know man the thing.
Well, first of all, I let people know say me a rare girl. I got sick 3 years ago. I come and do the test. They say I get the HIV. So I begin to take my treatment. I encourage everybody for go do the HIV test because you don't know. if you get am. I let people know say HIV dey. E dey because me na a victim. So I let people know say let them get the idea say HIV dey and e rampant. And if you not take your treatment, and if you not go do your test and know your status, you go die with HIV.
In conclusion, HIV is real and is on the increase. Therefore, you should get tested now. If you already know your status and it is positive, the best thing to do is to get to the nearest health facilities to start your antiretroviral therapy.